Chronic granulomatous disease CGD is an immunodeficiency disorder, genetic disorder. Look at this picture, shows that disease mechanisms and infections in the skin, a detail going on. Introduction. Chronic granulomatous disease is a rare inherited immunodeficiency disorder that primarily affects the body's ability to fight off certain type of bacteria and fungi. The disease is characterized by the ability of phagocytes, a type of white blood cell, to produce reactive oxygen species due to a defects in the NADPH oxidase enzyme complex. This leads to the formation of granulomas, which are clusters of immunocells that form at sites of infection or inflammation. Definition: chronic granulomatous disease is a rare genetic disorder that impairs the ability of certain white blood cells to produce reactive oxygen species necessary to kill specific bacteria and fungi. This leads to recurrent severe infections and granuloma formation, where clusters of immunocells formed to contain infections can cause tissue damage. Types: CGD can be categorized based on specific genetic mutation involved. 1. X-linked CGD. The most common form, accounting for about 70% of cases. It is caused by mutations in the CYBB gene on the X chromosome, affecting the GP91 PHOX protein. 2. Autosomal recessive CGD. This form is caused by mutation in other genes CYBA, NCF1, NCF2 or NCF4 that encode different components of the NADPH oxidase complex. Causes: CGD is caused by mutation in genes that encode components of the NADPH oxidase complex, which is crucial for the production of ROS used by phagocytes to kill pathogens. The defective enzyme complex leads to an impaired immunoresponse, making individuals susceptible to recurrent infections. Risk factors: 1. Genetic predisposition. A family history of CGD increases the risk, particularly if the inheritance is X-linked. To gender, X-linked CGD primarily affects males, while autosomal recessive CGD can affect both genders. Complications: 1. Recurrent infections. Infections can occur in various organs, including the lungs, skin, lymph nodes, and liver. 2. Granuloma formation. This can cause blockages in the gastrointestinal or urinary tracts. 3. Inflammatory conditions. Patients may develop autoimmune or inflammatory disorders such as Crohn's disease like symptoms. For organs damage, chronic infections and inflammation can lead to organ damage, particularly in the lungs and liver. Pathophysiology. In CGD, the defective NADPH oxidase complex in phagocytes leads to an inability to produce ROS, which are essential for killing bacteria and fungi. As a result, pathogens survive and proliferate within phagocytes, leading to chronic infections. The immune system attempts to contain these infections by forming granulomas, which are masses of immunocells that surrounding the pathogens but also cause tissue damage. Detailed breakdown of steps: 1. Genetic mutation. 2. Defective NADPH oxidase complex. 3. Impaired microbial killing. 4. Persistent infections. 5. Granuloma formation. 6. Chronic inflammation. 7. Dysregulation. 8. Tissue and organ damage. 9. Secondary complications. Signs and symptoms: 1. Frequent bacterial and fungal infections, particularly in the lungs, skin, lymph nodes, and liver. 2. Abscesses, deep seated abscess in organs such as the liver and lungs. 3. Granulomas may cause blockages or chronic inflammation. 4. Growth retardation in children due to chronic illness. 5. Fatigue and general malaise. Ongoing infections and inflammation can lead to fatigue. Diagnosis: 1. Nitroblue toluene test, NBT test. This test measures the ability of phagocytes to produce ROS. A negative result indicates CGD. 2. Dihydrohodamine DHR flow cytometry, a more sensitive test that also measure ROS production by phagocytes. Pre-genetic testing to identify specific mutations in the genes associated with CGD. 4. Blood test to check for signs of infections or inflammation. Nursing diagnosis. 1. Risk for infections related to impaired immunoresponse. 2. Impaired skin integrity related to recurrent infections and abscess formation. 3. Activity intolerance related to fatigue from chronic illness. 4. Delayed growth and development in pediatric patients related to chronic disease. 5. Anxiety related to chronic nature of the disease and frequent medical interventions. Management and treatment. 1. Antibiotics and antifungals. Prophylactic use to prevent infections. 2. Interferon gamma therapy. Boost the immune system's ability to fight infections. 3. Hematopoietic stem cell transplantation HSCT, potentially curative but comes with significant risk. 4. Genetic therapy. Experimental treatments are being developed to correct the genetic defects in phagocytes. 5. Corticosteroids to manage granulomatous inflammation. Psychosocial medicine. 1. Psychological support essential for managing chronic illness, especially in children and adolescents. 2. Family counseling to address the genetic nature of disease and the impact on family dynamics. 3. Support groups. Connecting with others who have CGD can provide emotional support and practical advice. Prevention. 1. Genetic counseling for families with a history of CGD, especially for those planning to have children. 2. Parental testing can identify CGD in fetus, allowing for early planning and intervention. In conclusion, chronic granulomatous disease is a complex immunodeficiency disorder that requires careful management to prevent and treat infections and complications. Advances in genetic testing and therapies offer hope for improving outcomes. But the disease remains a significant challenge for affected individuals and their families. Comprehensive care, including medical, psychological, and social support, is crucial for enhancing the quality of life for those with CGD. Thank you. Have a nice day.